In this video, we are going to decode a terminology which is SCUF, SCUF, slow continuous ultrafiltrate removal. First, what is it? It is a form or modality which involves removing fluid from the patient. It's one type of replacement therapy, renal replacement therapy. Since we can give it continuously over 24 hours, this name is SCUF, slowly, continuously ultrafiltrate. It's nothing but water being removed. If I put it in simple words, slowly we are removing excess fluid from the patient or fluid from the patient body with the help of a machine. What is that machine? It is the hemodialysis machine or a CRRT machine. This is cuff. Second, when to use it? Whenever a patient is in significant volume overload. When he can be in significant volume overload? In renal failure most of the time. But in renal failure, not only fluid, urea, creat, waste products will be there. That if handled along with this water removal, that goes under dialysis. The terminology is dialysis or continuous renal replacement therapy, intermittent hemodialysis, whatever the name you want. As per the prescription changes, you will say if waste products also removed. Suppose if only water is removed, this is the terminology. So renal failure, if only water removal we want. Congestive cardiac failure, a patient in severe congestive cardiac failure, excessive volume accumulation where we want to reduce the load on the heart, yes, it can be given. Also in decompensated heart failure, almost same, congestive cardiac failure, the extreme form decompensated heart failure can be given. Severe non-responding nephrotic syndrome, anasarca, albumin is very low, excessively accumulated in the extravascular space, so the edema is not coming down, at least to remove the intravascular fluid so that from the extravascular space it comes to the intravascular side. It can be tried, very rare, rarest of rare, anasarca we have used in patients. All this have one thing in common, that is the volume overload. These are all the uses. Coming to the one info related to the modality, we need a high flux dialyzer or a dialyzer with a larger pores which remove more volume, can be, if required, can be removed more volume, or a CRRT machine. Is CRRT machine compulsory for SCUF or slow continuous ultrafiltrate removal or simply water removal from the patient slowly? CRRT machine is not compulsory. You can do it with hemodialysis machine also. Only thing is prolonged duration might be required. Blood flow have to be reduced to a lower level. This is one info. Then coming to the rate. What is the rate that we are going to remove the water from the patient? Whichever the amount of removal which is going to give clinical stability to the patient. In absolute terms, if I have to put, very slow, or 2 to 10 ml per minute, or let me put it in a way where it will be easy to understand. Over 24 hours, up to 8 to 10 liters can be removed. In some patient, only 6 liter. In some patient, over 12 hours, 5 liter can be removed. That is a value in simple terms might be 200 ml, 300 ml, 400 ml per hour, or as low as 60 ml, 40 ml, 100 ml. Every hour it can be adjusted. Let me give an example. We are removing 100 ml per hour from a patient. We are removing for almost 10 hours, which comes as 1 liter. Increase it to 200 ml, it comes as 2 liter, 300 ml, 3 liter, 400 ml, 4 liter. But as we start removing the fluid, patient's BP might drop. Patient hemodynamic stability might be at risk. So we have to reduce the rate. Many times as we start removing the fluid, patient will be feeling better, BP might not drop, pulse will be going to the better range. better range, I mean homeostatic range, from the tachycardia it might goes down. So that time you might increase the fluid rate in the subsequent hours. So even in theory or any textbook, there is no value. What is the value that we are going to remove? It is the patient-centric decision. For multiple choice question, yes, you can select 2 to 8 ml per minute. Take it as 1 ml per minute, which is 60 ml per hour. So that is why I told on an average 100 ml per hour, 60 ml per hour, 40 ml per hour. You increase it also as per the patient hemodynamic stability. You can give for 24 hours or what? Yes, you can give it for 24 hours. The only thing is patient have to be in the same bed for that much time. Blood will be rotating as similar to dialysis. He can't move it. So that is why there is some difficulty. That is why most of the times only critical patients will get this treatment. Otherwise, most of the time we close this cuff over a period of 6 to 8 hours. Rarely, if required, 12 hours. Okay. Then any other question? What are the complication which can happen with the SCUF? BP might drop. Okay. The circuit, if it is getting slowly rotated, might get clotted. Circuit clotting, hemodynamic instability, most common cause clinically. Apart from that, any complication related to vascular access, bleeding, since we are giving heparin, that you can take into consideration. Any other question apart from this? We have seen what is it, uses, mechanism, few clinical info, and that's all. SCUF is a terminological play. The terminology can be in some textbook, it might be isolated ultrafiltrate removal. Don't get confused. In some book they mentioned CRRT machine is required. It might not be required. You can do it with the hemodialysis machine as long as the blood flow you can adjust it. So in summary, SCUF, slow ultrafiltrate or water removal from the patient. Indication, congestive or decompensated heart failure or significant volume overload for that matter. High flux filtrate or CRRT machine where fluid being removed at a rate, constant rate as per the patient hemodynamic stability is being adjusted on an average 2 to 8 ml per minute. You can put it as 100 ml at an incremental or decremental. You can do it 12 hours to 24 hours. One advantage is if the patient is hemodynamically stable and urine started coming, you might not require to remove it. Most of the time, if it is for volume overload, patient usually comes out. And advantages, patient hemodynamic stability can be ensured because slowly we are removing. Since patient is not excreting, we are removing it mechanically. So that's all. Bye bye.